Welcome to Mayo University Hospital. We are delighted to share with you our virtual tour of our maternity unit. To start with, when you arrive at the hospital, you will see a good set-down area where you can park and hop out. If you need to park, drive around the hospital and you can park in the car park. Coming back into the hospital, you will see the reception is on the left and you go directly into the outpatients reception. Once you check into the outpatient reception, they will direct you to the room. Follow the blue line to your destination. The first visit you may have to the hospital is what we call your booking visit. There you will meet the midwife and you'll also have your first scan. That visit usually happens between 12 and 14 weeks.
Hi, my name is Jenny. I'm one of the midwife sonographers in Castlebar in Mayo University Hospital. When you come in for your scan, we talk you through the procedure. We let you rest up on the bed and put cold jelly on your tummy. It really helps if you don't put on any cream or oil on your tummy for about a week before the scan, so we get the best pictures possible. So during the scan, we'll show you pictures of the baby on the monitor and we'll even give you pictures to take home with you.
From the scan, we will then introduce you to our midwife. She will take your history, your medical history, family history, and your partner's history. We'll also take bloods. From this information, we will plan your care for your pregnancy going forward. Each time you visit the antenatal clinic, make sure on your way out to book your next visit. You will be told when this is due, so just attend the outpatient reception and rebook your visit for the next one. When it's time for admission to hospital, follow reception around to the left and you will see the lifts or the stairs. Maternity is situated on the first floor. When you arrive at the first floor, you will see maternity. There's a sign directly above the doors. On the right-hand side of the doors, you will notice two buzzers, one for delivery and one for maternity. Buzz for the delivery for the midwives to open the door. Once inside the initial door, delivery is the first door on the right-hand side.
This is our admission room, so when you come into the hospital to be checked out for any reason during your pregnancy or after you have your baby, this is one of the rooms where we would see you. So we would get you to pop up onto the bed. We would check your blood pressure, your heart rate, your temperature, listen into your baby, palpate your tummy, all with your consent. We're here to assess your concerns and what's brought you here today and to plan your care based on our findings. We're here for you.
Welcome to the Maternity Assessment Unit. We see women here over 20 weeks gestation. You may be referred up here to be seen by the GP, by the clinic downstairs or from your midwifery-led clinic. Some women also present here if they're worried about their fetal movements, feeling unwell or have any concerns.
Once you have the initial assessment, you may transfer out to the maternity ward, especially if you're in the early part of your labouring or birthing experience. When you become more established, we will then transfer you back into delivery, where your care will continue. Once you go back into the delivery suite, the midwife will take over your care and she will work with you to plan your birthing preferences.
Hello and welcome to Mayo University Hospital. My name is Marcella and I'm an advanced midwife practitioner candidate. This is our low-tech labour ward. You can do any exercises and any equipment that's here is open and available to you. Here on my right hand side we have the shower. The shower promotes normality and it's a great analgesia in labour. All rooms are en suite and you're welcome to use it at any stage. We've moved the bed on purpose to the side so that creates an environment for you to promote more normality by mobilisation, to make it a homely environment for yourself. The TENS machine is a great low-tech analgesia. It's particularly good if you've got lower back pain. The Antenatal also can be used in labour. Midwives will be with you and we will help you and guide you in the use of Antenatal. We have an array of equipment all set up. Exercise ball, peanut ball, bean bags and soft mats to encourage any movements that you need to. So enjoy your journey and enjoy the birth of your baby, and we're delighted to be here to assist you in any way we can.
If for any reason during your birthing experience we need to use the operating theatre, we can do this very quickly. It's down the end of the corridor from the delivery suite.
So when you have delivered your baby, you will be welcomed to the maternity unit. Each bed space is set up the exact same in each room, and you have a cot beside your bed that is see-through that you can see your baby at all times. Each bed space comes with a wardrobe, a locker, and we have a call bell here for you to use if you need to call the midwives for any assistance or help. And each room has a toilet and a shower facilities for you to use during your stay.
Hello, my name is Rachel. I'm the HCA here on the ward, in the maternity ward. This is the nursery that we would use if the midwives was checking baby and doing the discharge checks. And behind me here is where I would do the baths with the little babies. And this is the resus chair up here to keep them nice and warm.
Should your baby have any other needs, they may need admission into the special baby care unit.
We look after babies here and we can cater for all aspects of neonatal care. The team is led by a team of specialised doctors, nurses, and we are helped by the allied medical professions. And I can assure you that if your baby is in special care, that we will support you through all stages of your journey.
We have a room in maternity called the Rose Room, and we use that to care for families in special circumstances.
My name's Orny McGrillen and I'm the perinatal mental health midwife here at Mayo University Hospital. My job is to support women with mild to moderate mental health problems, and mental health problems affect probably about 20% of women during pregnancy and until their baby is about 1 year old. So it's really important that we have services in place to support families around this time. The most important part of my job though is promoting a culture of perinatal mental health awareness within the hospital, so that women and families know that when they come to Mayo to have their baby, all the professionals that you meet are as concerned about your mental well-being as with your physical health, and that if you do have any concerns or worries, that these will be listened to and that you will be signposted to the appropriate support.
My name is Jennifer and I'm one of the antenatal education midwives here in Mayo University Hospital. We offer a comprehensive antenatal education programme for all our expected parents, meeting your needs. We offer an early education programme that we invite you before you even come to your booking visit, where we will talk through the different symptoms of pregnancy and how to cope with the same. From 32 weeks on, we will invite you to start your antenatal education programme. We start with labour and delivery, discussing pain relief options, birthing positions, and talking about birth preferences or birth planning. Then we move on to postnatal and discuss what happens when the baby is born, the different checks that are done, and what you can expect in this period. We talk about practical things like caring for your baby, bathing your baby, changing your baby, and winding your baby, and answer all questions that you may have. Our third class is breastfeeding or infant feeding workshop, where we will plan how we are going to feed your baby. Your choice will be supported whatever you decide. Our fourth class is hypnobirthing, where we teach you different breathing techniques, massage, positive affirmations to help you through your birthing journey. So when you're going home, we will invite you and your partner and your baby to a postnatal discharge class, where you go through all the information that you possibly need before you go home. Going home is very daunting with your baby, and we will help you to prepare for this journey. You will also meet the perinatal mental health midwife, where she will discuss and talk through the emotional changes that happen when you transition into becoming a mum and a dad. You will also be joined by the physio, who's our women's health physio, and she will teach you different techniques and strategies and exercises to help you recover post-birth. I hope you enjoy your antenatal education programme as much as we have preparing it for you.
Just for your general information, we have a coffee shop at the front foyer, we have toilets throughout the hospital, we have a canteen in the basement, and we have an oratory on the first floor near maternity. Congratulations on your pregnancy. We hope you enjoyed our virtual tour in Mayo University Hospital. If you have any questions, please contact us. We're here and happy to help.